COVID-19 is an infection disease caused by a virus known as SARS-CoV-2. The disease spread worldwide, leading to COVID-19 pandemic. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar, and today we're going to talk about adults with blood cancers' response to booster, not initial dose of COVID-19 vaccine. People with hematologic malignancies or blood cancers included leukemia, lymphoma and multiple myeloma have an impaired immune system due to their disease and its treatment, putting them at risk of severe COVID-19 infection and experiencing a reduced response to COVID-19 vaccine. In a recent study published by Wiley Online in a peer-reviewed journal of the American Cancer Society, less than half of patients with hematologic malignancies mounted detectable antibodies after initial COVID-19 vaccination, but 56% of non-responders produced antibodies after receiving a booster dose. For the study, Thomas Ollila, MD of Brown University, and his colleagues retrospectively analyzed antibody responses to initial and booster COVID-19 vaccination in 378 patients with hematologic malignancies. Anti-SARS-CoV-2 antibodies were detected in the blood of 181 patients after initial vaccination with one of 3 US Food and Drug Administration authorized or approved COVID-19 vaccines, and patients with active cancer or those recently treated with an immune cell depleting therapy were least likely to produce these antibodies. Among patients who did not mount an antibody response following initial vaccination, responses were observed after a booster dose in 48 of 85 patients who were assessed. Dr. Thomas Ollila concluded that according to our findings built on the wealth of literature showing that patients with hematologic malignancies have an impaired response to COVID-19 vaccination. Importantly, we show that many of these patients who did not respond initially will in fact have a response to booster vaccination. Moreover, when we looked at outcomes, we found that deaths from COVID-19 in the patient population we reviewed only occurred in those with undetectable antibodies, and nobody who received prophylactic antibody therapy was diagnosed with COVID-19. This suggests to us the importance of checking antibody levels in these patients and arranging prophylactic antibody therapy. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.